Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson, and as always, I am joined by RipsyTech founder and CEO, the distinguished Tom Tarshis. Hi, Tom.
Parker, nice. I knew you were going to come up with a different word and voice inflection, and very impressive. So nice to see you. Strong work.
Thank you. Yeah, I whipped that up about 5 seconds before I started recording. I opened a new tab, typed in synonym for illustrious, and that's how we got here.
Very good. Very good.
Well, for today's episode, we wanted to talk about a pretty big topic, something we've touched on a little bit in the past, but never done like a full-blown dedicated episode to, and that is marketing your practice. Before I dive into the questions, anything you want to say about marketing?
Yeah, mainly that I'm not a professional marketer by any means. I have some very good friends who are professionals that have been great at giving advice at different points. And yeah, it's a very important area for anyone running a business, and especially with, decreased stigma and more providers in the mental health space, it is something that people need to talk about and learn about and do something with, because even though demand still far outpaces supply in this field, you want to get your name out there as a mental health professional.
Yeah, I mean, makes perfect sense. I was thinking about it, and I kind of like co-manage a lot of the marketing that we do for RipsyTech. So, this might end up being more of like here's a question, and we kind of talk about it or discuss it. I definitely want to hear your opinion from the perspective of the provider. But this is something that I might have a little bit more to say on than the usual topic. So, with that said, the first thing we wanted to talk about was just the idea of building a marketing plan and this idea of a brand identity. That can look like a lot of things. That can look like a logo. That can look like a color scheme. That can look like the type of words that go on your website. So let's talk about it. What are some key steps that might be required from building a marketing plan? What are some elements that help build a strong identity or a strong brand for a practice?
Yeah, and a great question. And I think one of the questions coming up is also, how much do you do yourself or how much do you hire someone? And
yep.
It is good to keep in context that marketing costs money. Not all marketing costs money. But as you're developing your brand and your plan, you should set what your marketing budget is. I think at a minimum, you're going to need to pay for a website. And that's maybe the minimum cost outlay. Then there is cost associated with your time. So it's something to be thoughtful about. But that piece aside, every business, even if you're a solo practitioner, you should have a marketing plan and work on what your brand is as a solo practitioner. So if this is something that you haven't thought about, you're going to want to think about who is your targeted patient population, who's your passion for working for, who are the patients and clients that you want to attract, and how are you going to sell yourself based on your strengths and who you are and your style to bring the right patients who are a good fit to you. When you're starting a small business, lots of times the initial stuff is very fun for people. You're excited to start your business, coming up with a logo or what's the name of your business going to be called. Those things are fun. It's cool to go on the internet and go to a domain name site, and lots of things are taken, but there are lots of things available. So what are you gonna? There's a .health, like .com. There's .health, and there's other web domain spaces that can be snatched up still that are reasonably priced, and trying to come up with something with respect to your name, your logo, and branding all makes sense to have that intertwined. And I think as our UX UI designer, Parker, you mentioned the color scheme, and
Right.
something I maybe hadn't thought about as much before until you came on board, but that is a very basic logo, color scheme, brand identity, all ties together. So again, not as an expert, but if you're working with, mainly want to work with kids, you're maybe, and you can help on this, right? You're going to want a color scheme or logo that's different than if you're working with older trauma survivors.
Right. I mean, yeah, the audience is, as you said, a really important factor to consider when you're putting any of that kind of stuff together. I think, like, if you were asking me right now, like, what would you do for which one? I'd probably use more colorful, more variety colors for something like for children. And then if it was for something a little bit more serious, it might go for like something that you might expect from like your typical type of healthcare provider, like a white and blue kind of sterile environment type of color scheme. Those are very common. Just look at most insurance companies, most health insurance companies, I should say. But yeah, I mean, there's, as you said, there's different styles for different audiences.
Yeah, and I think for the 5 companies I've started, for the very first one, I hired a marketing student from a local university to develop a logo and color scheme, and she did a great job. The second one I started, I just made my own logo as a play on Tetris for technology therapists. I don't know.
Oh, very fun.
Remember?
I think I've seen that. Yeah.
By far the weakest of the different logos. And then for the third company, we did there's a very cool thing you can do where with the internet, you can pay a few $100s and say, here's what I want my logo, the meaning of it, and throw it out there to the world, and all these people compete to land your logo.
Yeah, it's
and
an interesting process.
And I forget the actual company. I can figure it out though, and we could put it up. And that's what we did for the third company. For the fourth company, we again hired someone with skills in as a artist and marketer to develop that logo. And for RipsyTech, I think it again fell on another marketing person.
Well,
I think you and Ryan developed our logo, correct?
It was me and Jake, actually. Shouts out to Jake. We worked on that. That was a big project we did the summer of 2022. Jake Potter, shouts out. Yeah, that was a fun process because we had, an original website and an original design, and then we were kind of given the creative freedom to come up with something different. And I think I owe a lot to Jake when it comes to like our color scheme. He was pretty junior at the time, so I kind of gave him like the basic 101 on color theory and told him to kind of go nuts coming up with different combinations. And the one that we landed on was what we have now. And we did get a little bit of help from a marketing person at one point. We had like a brief meeting, and that kind of gave us enough information to, be off to the races to come up with our own thing. But yeah, I mean, that just kind of opened up my eyes to all of the different options that exist for both just like different tools that exist for choosing a color scheme. Coolers, shouts out. That's a great website. Check that out. But there's also different websites where you can find your logo. If you Like you can get a free logo, go to logo.com. You can generate one, customize it yourself, and it's free. And you have the license to use it for your business. So that's a great place to go if you just need something simple. It's always more fun to make your own, but definitely can lead to some feelings of inadequacy, I guess, if you don't have a ton of logo design experience and then look at like some other websites and you're like, oh, dang, like what am I doing here? But I'm pretty happy with some of my own logos.
Yeah, no, great comment. And your logo is going to be used for your web page if for nothing else. There's less people that have business cards these days just because of the way the world is. And you don't necessarily need the color scheme of your logo to match the color scheme of your clinic or office, though it certainly could.
Oh, sure.
But that name and logo, are going to be what your business is about. And it's, we know when you're working with, we know from neuroscience that repeated positive associations with different shapes or colors or names is how you build recognition and positive feelings. So it is going to be key, regardless of the size of your company, to get your brand and the components that go with it and stay with it.
Absolutely. And I think, RipsyTech is not a healthcare provider, but definitely when it comes to different industries, there are usually kind of like, I don't want to say socially acceptable. I guess industry acceptable colors. Not necessarily specific because everybody's going to use blue for something. But definitely, there are like acceptable colors for different industries. Like medical, you're probably never going to use bright red. That would be a bad move. I think like darker colors is also kind of, a lot of people tend to go for lighter backgrounds for anything medical focused because it represents like a sterile, clean environment, and we want to feel like we're in a sterile, clean environment when we see, anything pertaining to our safety and health. Red definitely doesn't help with that either. I want to go start a black and red color scheme hospital now that I'm talking about it, just to try it out. Yeah. Anyway, just to kind of keep the ball rolling here. There's a lot that goes into building a brand and building a business, and you definitely there's an element of all of the things that you show to represent the quality of your brand, but then there's also kind of this component of after you have been practicing and you kind of build up a reputation, to a degree, like your brand mark design and logo and just like color scheme can become synonymous with like high quality. And those are, every brand I think strives for that. But let's talk a little bit about like a website, for example, because that's also a huge undertaking. So there's a lot of different website builders out there these days. What was your experience with a website for your business? Did you hire people for that? Did you do it yourself at different points? Let's dive into that.
Yeah, and I think because of my coding background and developer background, initially when websites were more complicated to do on your own, and I remember when WordPress first came out, I definitely did all of my own websites for many years, and then with the advent of the much friendlier design websites like Squarespace and Wix are the two biggest, and WordPress has evolved also, I definitely started handing over the website design to others, and people with a little more artistic flair or better, who are a little more trained in user experience and what should be present. And the great thing is there are lots of people who can do your website for you at a very reasonable cost now. And I think the most important advice that I give to people is don't give someone full control over everything, and make sure you know how to log into your website and change text on a page. And if you need to do something, make sure you know how to do it, because I've met, dozens of mental health clinicians that don't even know how to log on to their website to make changes. And that's dangerous if someone decides to go rogue who's doing your website. And you don't always want to be paying someone hourly for their time to make a simple change to your website that you can do yourself. So we use Squarespace right now. I use Squarespace for both of the businesses. Because of our blogging and podcast efforts, some people would say we should maybe be using a WordPress-backed website for RipsyTech, but I think things continue to evolve and make it very easy. Squarespace makes it very easy for integrating with Google Ads and other tracking systems that are nice to provide nice tools as a business owner.
Yeah, there's a lot of really good stuff that you just said in there that I want to respond to. But personally, I've never heard that about I've heard that people used WordPress a lot for blogging when it first came out. But I never thought about, should we have our own WordPress website because we do like a blog and podcast type deal. But that's a really interesting point. I've always wanted to learn more about WordPress. I have developed a familiarity with Squarespace. I think the next time I want to design a website, I want to challenge myself to use something different, like a WordPress or even a Webflow. But Webflow is not, that's like a designer. If you're really trying to make like a complex website without going full into the code, that's one that I would recommend. But if you're a provider who just wants to use a template, I would go with like a WordPress or a Squarespace. Shopify exists, not something I'd probably use for a mental health provider, but that's just another one to throw it out there. There was something else that you said that I wanted to respond to.
While you're thinking about
logging in. Sorry, I got it. Logging into your website. Yeah, definitely. If you do have that is great advice. Like that is fantastic advice, because you don't want to be locked into having to contact this person for their time every single time you want to make a small change. I know that there are, I know design firms in my local community that do like really large scale projects for very high profile clients. And those are kind of like, the web-based projects become so complicated that the clients do have to reach out to the design firm to make changes when they make changes. But there's no reason that a mental health provider should ever have to be put into that situation. So definitely, stick to something simple that you can log into, that you know how to navigate. And if you need to make a change, that you can confidently make it yourself. And also, if you don't know how to do it, at least look up the solution.
Very good. Very good.
Sorry, what were you going to say before I went off on that?
I was just going to say that, for a lot of clinicians, things like Squarespace offer some scheduling tools now with calendars and reminders, and there are some other enhancements depending on what your current EHR can provide you with that you might find useful with collecting payments and calendar. A lot of it is not perfectly suited to a health field, but nevertheless there are some other synergies with using some of the major brands for your website.
Yeah, and different. I believe there are different EHR companies that also offer some kind of integration with whatever website you're using. In our case, we provide links to different appointment request forms, and those are things that can go onto your website. It really helps. You want the most eye-catching button on the page to be request an appointment with this person, because that's that's what we call a call to action in the web world. But yeah, you want the call to action to stand out the most and be the thing that catches somebody's eye and say, oh, you want them to request an appointment, then make it stand out. Yeah.
Very good. Very good.
Thank you. Yeah, lost my train of thought there for a second. So let's talk about digital marketing, social media. Is that something you have experience with for your practice?
Yeah, I'd say like we have social media accounts, especially with Facebook and LinkedIn. We had done a little bit with Instagram before, but we weren't really using it necessarily as, hey, let's attract patients through here. It was more, getting some messaging out, I think, through the nonprofit entity, helpful to make some announcements. Sometimes better for recruiting employees than, say, for trying to attract patients to your clinic. So it hasn't been something that I've done a lot with. However, there are lots of mental health clinicians and groups that are using social media and digital marketing more extensively to attract clients, especially if you're not taking insurance. So if you take insurance, you're going to get on insurance panels, and that is going to get your information out there on the internet when people are searching. And I think you could call putting a profile on Psychology Today would qualify as digital marketing.
I was just going to bring that up. Yep.
Yeah, and I do have a profile on Psychology Today, and I think they are the number one source of people looking for specific providers or some providers in their area, other than just web searches. And so that it's also very affordable, which is a good strategy by the Psychology Today group. Go ahead.
Go
ahead, Parker.
I think every time I've found a new therapist, I went through Psychology Today. I also wouldn't discount Yelp as a potential option. It seems odd, but there are a lot of therapists listed on Yelp, and if somebody's using that, you'd want to be present in that space as well.
Yeah, and it comes to that comfort level of, how do you get those positive Yelp reviews? You can certainly list your business on Yelp, but until you have some reviews,
right,
maybe less likely to show up. I think that as child providers, sometimes you get parents that want to leave you a positive review, and that feels cleaner because on some, you are treating the family, but that's not your specific patient. And if someone wants to leave you a good review and they're comfortable putting their name out there, that is very helpful. And positive Yelp reviews can be a very good thing. I've never totally felt comfortable just soliciting for positive reviews. That doesn't mean it's wrong. I know every time go to see our dentist, they're asking for positive Yelp reviews. That's not the case when I go to see primary care provider at a big group. But I think in today's market, there's not necessarily anything wrong with, having a sign on your door saying, please like us on Yelp. I think it is okay.
Yeah, the reviews thing is interesting. We're skipping ahead here a little bit, but we are low on time, so it's good to skip ahead here. The reviews thing is interesting because definitely, I look up reviews for almost anything and everything, but definitely, like when it comes to a doctor, I will probably look them up as well. Just searching somebody. A therapist, I will probably search them up. But when it comes to a mental health provider, it's a very interesting thing because some people, they might not want to post a review because there still is some stigma around mental health. That is getting better, but there is still some stigma around, revealing I went to this person for therapy. So, and that probably makes as a therapist, as you're mentioning, like a little awkward to solicit a review from somebody. But at the same time, I think in my experience, like I've had providers that were awesome, but then when I looked them up after the fact, it was like, whoa, this review that somebody wrote is crazy, but also like it's probably not true just with how out there it was. So I don't know. I think I think the better reviews for therapists that I've seen are specific about like the quality of care that you receive. At the end of the day, that's the most important thing. But also, if there's any kind of like shady administrative practice, that's also a good thing to be watching out for.
Yeah, and you're right. I think sometimes you can get bad reviews just because someone can't get into for an appointment, and maybe the communication wasn't great about that, and that's very frustrating. And our whole mental health healthcare system sort of struggles with this issue. And I think, as far as how do you respond to positive or negative reviews, it's very easy for a positive review to say thank you so much or just not respond. For the negative reviews, I think it is okay to respond. Of course, you're not, some people fall back on privacy guidelines as an excuse to not respond, where they'll say, sorry, we can't comment on this due to privacy concerns. And that's, on some level, I think that's a little bit of a cop-out. I think you can, without being specific, respond and either apologize if something didn't go well around communication or cost or anything like that, or try to, clarify or explain why something happened. And I think you can do a lot of that without violating any privacy concerns. And so, of course, you can't talk about specifics from a clinical visit or HIPAA information, but if someone says you're a crappy therapist, you could certainly log in and say, sorry you had a bad experience. I've done this training, worked very hard on these pieces, and talk about your general skills as a provider and what you strive for without giving any specific information. And I think that is okay to do. You are, as you know, Parker, people are more likely to leave negative reviews than positive ones, and
on every place on the internet. Yeah.
So it is, if you're immediately, once you're licensed as a mental health professional, your name is out there, and you should thicken your skin and expect to have some negative things written about you on the internet.
Does that, I guess I can't speak for myself here, but I feel like if there is a demand for services, that people will request an appointment with you if they really need help. And hopefully anything negative written about you on the internet is not truly indicative of the quality of care that you can provide.
Fair enough.
Okay, let's... Yeah. Okay, so I want to quickly talk about, for you as a provider, what would be like a good metric for understanding, like, is my marketing helping me? And how might you choose to adjust based on what those metrics are saying?
Yeah, and this is where, when we were designing our product, actually, if you use our appointment request form, one of the first questions is, how did you hear about us? And essentially that provides the answer to how you should or should not adjust marketing efforts. So if your clinic's full and you're getting plenty of business, no need to adjust anything. But ultimately, every practice should be asking where new patients heard about you. And then you can summarize that data. Was it from an insurance website? Was it just from an internet search? Was it from a colleague who knows you and is sending you patients? And then figuring out, hey, okay, so this is my top source, happens to be this one provider I had lunch with and we get along great, but they're full and they sent me 5 patients in the last 2 months. You want to be aware of that, and you want to thank them if that's been good. And then when you do get openings in your practice, know to go back to those top sources of referral, whatever they may be. If you're spending a little money on a Google Ads campaign, or with your website, if you're trying to build that out and get some more content on the internet where people just from non-paid internet searches, your name comes up, you want to see how many people actually did find you from an internet search, and even getting more granular, what did they search for that found you? Mm-hmm. And so ultimately the answer is, for the patients you get, how did they hear about you? And then track that, and for your specific practice, use that top technique when you need to get more patients.
Yeah, that sums it up pretty well. I'm hesitant to open up a whole can of worms asking about these platforms like BetterHelp or Headway that kind of do some of the marketing for you. Do you have any kind of quick thoughts on those?
Yeah, I mean, the big platforms sort of dominate the provider search bars, and they're going to pop up every time. And it's not something that I've looked at or explored. I know some colleagues do, but yeah, I don't feel super qualified to give an opinion on some of those.
Yeah, well, I guess all I will say, just based on what I know, I mean, I've never personally used either of those platforms. Well, actually, no, sorry, that's not true. I've used Headway to find a provider before, which did work pretty well. But I think, I've heard all kinds of different things about the quality of the help that you'll find, or the quality of the position that you'll be put in as a provider. But at the end of the day, the biggest benefit is the marketing component of finding a patient to connect to you, because that kind of, whatever you are paying that platform, that's ultimately going to be considered your marketing budget. So I think the biggest question just is, is the amount that you're maybe having taken away from you to be on this platform worth the cost? Is it providing the amount of patients that's going to offset that cost of how much you're losing than if you were doing this, vanilla without the help of the platform?
Good comment. Yes, very appropriate.
I think maybe we can wrap up here. This is probably not going to be the last time we talk about marketing. It's a whole industry, whole discipline. There's no way we can wrap it up in 30 minutes. So with the little time that we have left, let's go ahead and wrap things up. So thank you for joining us on this week's episode of Sit and Stay Podcast, brought to you by RipsyTech. If you have any questions you would like to submit to our audience Q&A, or are interested in featuring as a guest on the show, send us an email at sitandstay@ripsytech.com. All right, Tom. I'll see you later.
Thanks, Parker. Yep. See you soon.
Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.